Welcome back, everyone. You're watching Coastal Living. Now, you may have thought that you had to wait until next year's annual enrollment period to switch your Medicare plan if your current coverage is not meeting your needs. That is not true for local residents. So, joining us today from Dallas is Dr. Rhea Joseph. She is a primary care physician with WellMed. Welcome to the show.
Thank you so much for having me.
All right, so I have a lot of questions. This is interesting, and it's my first time hearing about having an opportunity to alter your insurance. So while the Medicare annual enrollment period has ended, we do understand that there are rules that allow local residents to change their coverage at any time of the year. First and foremost, why would we want to switch?
So the biggest reason that most people switch to another Medicare Advantage plan is so that they can get a higher rated plan. The government assigns each Medicare Advantage plan a star rating from 1 to 5. 5 being the highest rating that a plan can get. Now, how the patients benefit from this is that if the plan gets 5 stars, they can switch into it at any time during the year.
Interesting, which benefits both the person and the company, right? So I had no idea there was actually a star rating to these organizations. Tell me, how does a plan achieve a 5-star rating?
So there are a few ways that these plans get evaluated. One is how well are we treating our patients through preventive care. So this includes no-cost screenings, immunizations, tests. Now, this is my favorite part. So I became a doctor so that I could promote preventive medicine. If we diagnose people with breast cancer and colon cancer during the earlier stages, they tend to have much better outcomes. Another way that the plan gets rated is how well we take care of chronic medical conditions. And we have so many patients out there who have diabetes, heart disease, respiratory illnesses. So it's very important that we take care of them. And then, of course, just the overall patient satisfaction.
Absolutely. And of course, it is very important to get early detection. That way we can prevent any fatalities from these types of diseases. Now, how do you find out about 5-star plans in the area? How do we get more information on that?
Sure. So we've made it easy for you. There's a website, wellmed365.com. Now, this has links to Medicare.gov as well, and it'll direct you to information about 5-star rated plans in your area and other plans that have other ratings that are available to you.
Wonderful. And so are there any other ways that people can change their plans during the year without having to wait for that annual enrollment time?
Yes, so most Medicare patients may be able to switch to a 5-star plan anytime during the year. If you're eligible for both Medicare and Medicaid, you can switch to a dual eligible special needs plan anytime during the year. And it's also important that I mention that if you have a Medicare supplement plan and you switch to a 5-star plan, you can always switch back during the year.
Okay, very interesting. I had no idea you could do a dual. I'm learning so much from you. I didn't know you could do a dual plan, which I find very interesting. And it's evident that diseases like diabetes, heart disease, cancer are at an all-time high. What is the reason for this?
So in terms of why it's at an all-time high, there's many reasons, but one of the big ones that I will touch on is our diet and our exercise habits. You know, we're not outside as much as we used to be. We're eating a lot of foods that are processed and has saturated fats, and Corpus Christi specifically also has plans that are available to them that pertain to chronic medical conditions. So if you have diabetes or heart disease, you might be able to find a plan that specifically meets your needs for this.
Wonderful. And does WellMed support sort of programs to help people with preventative things, getting them moving and getting them on a healthy diet?
Yes, so in terms of, I can speak for my clinic, you know, we have an educator on staff. We make sure that patients, because for everyone it's different. So some people might know how to eat right, but they don't know how to exercise right. And some people may know, you know, exercise is pretty straightforward, but I don't know what exactly it is that I'm supposed to be eating. And we start from the, you know, from the beginning, starting from grocery shopping. So we have those resources available. My clinic specifically also has, you know, classes classes that they offer every month so that we can teach them in person rather than just handing out brochures, you know?
Exactly. Well, it's wonderful to know that we have all this information available to us, especially to be able to come and get one-on-one education on things like diet and exercise, which are crucial and so important to preventing these fatal diseases. Tell me, where can we get more information about your program?
So I would say the easiest place is wellmed365.com because it has links to the Medicare.gov. The most important thing is to find a plan that fits you. And these websites will take you to links that, teach you all about 5-star plans and other highly rated plans. And that's the first step.
Wonderful. Well, this was a very informative interview. I appreciate you taking the time to sit with us. Hopefully our viewers at home got a thing or two, and now that you know you can enroll with this 5-star company, then you can look into the dual program and see what works best for you. Thank you so much for your time today.
Thank you so much for having me.
All right, everyone, we learned a lot and we're not done yet. Coming up next, we have more awesome segments right here on Coastal Living. Stick with us. We'll be right back.